Jennifer of Freeman Health System, talking about starting a caregiver support group, which is really going to be helpful to a lot of people.
Yes.
We forget about the caregivers sometimes. They're there to keep doing the work and keep doing the caregiving, but what about them? Is that why you got this started?
Yes, this is a pretty personal mission for me. I have been working on this for a couple of years now, since November of 19. Actually, I lost my father 2 years ago this month, and my mother was his personal caregiver for years prior to that. And then when I went to a conference in November of 2019, I was able to attend several breakout sessions on caregiver support and how important that was, that we support our caregivers, because, you know, without them, our patients would be in, you know, sometimes without anyone. So I came back from that thinking, you know, this is something that I really want to implement here at Freeman. It's something that we're lacking. We haven't ever had one. So I've been working on it for about 1.5 years now.
Well, good. We're glad that you have, because this will be very helpful to many caregivers. I know there are a lot of stressors on our caregivers. What are some of those?
Yes. Caregiving can be challenging and stressful, and sometimes even overwhelming at times. Not only taxing physically, but even mentally and emotionally. Throughout my career as a social worker in the healthcare system, I've seen the impact on our caregivers. They often have came to me with concerns of even guilt, feeling that they haven't done enough or wish they could do more. And I have to remind them that they're human. You know, they're not only trying to balance their own lives, but the responsibilities and role as a caregiver is a lot. And they're doing just the best that they can. And so, you know, reminding them of that, they need to hear that. It's so very important, yet so easily forgotten.
Yes, it is. You're exhausted from doing all that you're doing. You want to do the best that you can, especially if it's for a parent or a loved one. Is this mainly for children that are taking care of their parents, or adults that are taking care of their parents, I should say? But or is it for anybody? What type of people are you looking for to come to this?
Absolutely anyone that is what we consider a caregiver. We have approximately 65.7 million caregivers in the United States.
Wow.
It's 29% of the adult population. And, you know, they're caring for people that obviously aren't able to care for themselves for one reason or another. Those can be children, adults, elderly adults, it doesn't matter. They can be caring for them because they've had an injury, or they're disabled, or they have chronic care condition, you know, chronic health condition. All the variations there. So we want to make sure that everybody understands that we want to include all of them, whether they're a full-time or a part-time caregiver as well.
Okay, so anyone really can come be a part of this. And what dates is this going to run? What day do you have this?
Our first meeting is scheduled for Thursday, March 25th at 10:30 a.m. We're going to be out at Freeman East in the conference rooms there. And after that, we're going to be every third Thursday of the month going forward.
Great. So this will be something that people can keep up with and be a part of this.
Yes, we hope so.
And there's so many stressors that are put on our caregivers. What would you say is the best part about the group? Is it because they connect with each other and are able to hear each other's stories?
Yeah, you know, these selfless individuals need support. They need camaraderie. They need access and education to the community resources. There are so many out there that people are not knowing. They often, you know, need to be reminded of the importance of self-care and how to avoid caregiver burnout. We want them to have this group available to them as they need it, and to provide, you know, their needs and make sure that we're addressing those, whether it be education or resource connection, fun activities, or just, you know, communication with others.
It's just nice to have a group to get together and share some of your concerns, isn't it?
And to know you're not alone.
Yes.
To normalize it.
You are not alone. You're for these selfless people, the way that you had put it, they're so selfless in their caregiving. They need some support, and this is going to be a great continued thing that they'll be able to be a part of. Thank you, ladies, for being here.
Thank you.
We appreciate it. We want you to stay with us because we have meteorologist Chase Bowman on the way. We'll be right back with him.
Your premier game